52-year-old diabetic man presents with fever, headache, and excruciating pain in his right eye. He has been experiencing symptoms for the past 2 days. He says he has been taking sitagliptin and metformin regularly. He reports a recent sore throat. On examination, vesicles are present in groups with an erythematous base on the upper eyelid, forehead, and nose, all on the right half of his face. Patient is prescribed an antiviral agent and sent home. Which of the following nerve is most likely involved? Nasociliary nerve, ophthalmic nerve, supraorbital nerve, supratrochlear nerve, and lacrimal. This patient has shingles, right? Shingles is caused by varicella zoster. It's not CMV retinitis, it is shingles, okay? Is herpes zoster infection, or we can call varicella zoster infection as well, mainly affecting the ophthalmic nerve because of the areas being involved, upper eyelid, forehead, and okay, and only half of the side. Whenever patients have herpes infection, the herpes virus they remain dormant, either in the dorsal root ganglion or the sensory ganglia of these cranial nerves. They can get reactivated when the patient is having some kind of infection, like in this patient, I think he had some kind of sore throat and fever going on, right? So he's little bit infected with something, and so kind of taking in advantage of the immune system, they can get reactivated. Or if the patient has any stress going on, or if the patient is immunosuppressed, right? All of these conditions can reactivate the virus, causing eruption of these vesicles in that particular dermatome that is supplied by that cranium. Over here, it's the ophthalmic nerve, and that is what we are describing over here. Okay? Usually, you just give them antiviral agent. Can somebody tell me what is complication of shingles? One complication. Also, we have vaccines now. I think they give it above 65 years of age. That is another thing you may want to remember. Just review your guidelines. Above 65 shingles vaccine. So yeah, what's the complication? What's the complication that these patients usually get? Neuropathy, yes, they do have neuropathy. They have a particular term, we call it post-herpetic neuralgia. Okay, they have excruciating pain in that particular dermatome. After these vesicles and all gets cleared up with the antiviral agent, that's what remains. Okay, that's post-herpetic neuralgia. So nasociliary nerve, other branches, nasociliary, it carries sympathetic and parasympathetic branches. Basically, it is a branch of ophthalmic nerve itself, but it carries sympathetic and parasympathetic fibers. The supraorbital nerve, it is also a branch of ophthalmic nerve, but it's going to supply your forehead up to the vertex. Okay, so that supplies your kind of scalp area. And then supratrochlear is going to be the middle portion of your forehead up to the hairline. Lacrimal nerve is going to be the lateral part of your upper eyelid. Now over here they mentioned that upper eyelid, forehead, and nose is involved, and that's why the answer is ophthalmic nerve and not the specific branch.
Thanks for watching. Please give a thumbs up and subscribe for more.